It's time for health. Of course, this morning we have Dr. Olanrewaju Olaintan, who is an emergency medicine doctor, medical doctor based in Manchester. He has a Bachelor of Medicine and a Bachelor of Surgery from the University of Bristol. He also holds a Bachelor of Science in Pharmacology. Now, Dr. Olanrewaju is also the co-founder of the venture capital-backed medical technology startup MedCircuit. And today we're talking about ED, erectile dysfunction, a challenge most men face around the world but are too ashamed to talk about. Hello, doctor. Good morning. How are you doing?
Good morning. How are you?
I'm good. Okay, so we're talking erectile dysfunction today. Let's start from a definition. What exactly is erectile dysfunction?
So erectile dysfunction, it means the inability to actually get or maintain an erection for a period of time to allow intercourse. That's what it actually means.
Okay, let's talk some numbers now. What are do you have any numbers about how this affects men around the world?
So erectile dysfunction is the most common sex problem that affects men in the world. So the most common, very difficult to give a concrete number on how common it is because most men who have it actually don't seek help because of embarrassments. So it's something that actually it's very, very common, very, very high. They estimate about 70% of men at some point in their life will have erectile dysfunction, but it's very hard to actually narrow it down to say actually this is the exact number, but we know it's very, very common and men don't seek help enough for it.
Okay, so let's talk causes. What are the most common causes of ED?
That's a very, very good question. There are different causes for it. There's physical causes, there's psychological causes. Most causes is about physical. So things such as diabetes, high blood pressure can cause it. Drugs can cause it. Alcohol can cause it. Smoking as well can cause it. Then when you go into the psychological aspect of it, then stress, anxiety can cause it. Depression can cause it as well. So there's a very broad range of things that can actually cause erectile dysfunction for a man.
Okay, now before we talk about curative ways you can cure it, let's talk about being proactively prevent it. Is there any way men can proactively prevent erectile dysfunction?
Yes, absolutely, and I think that's a very important topic as well. The main way men can actually try to prevent erectile dysfunction is by being very active. So being active in your daily life, exercising, eating well, avoiding certain things like smoking, avoiding excess alcohol, and seeing your doctor regularly to make sure you don't have any underlying conditions. So most men, when they have erectile dysfunction, it's normally cardiovascular, so it's normally heart disease that normally causes it. But men don't actually realize that's the cause until they get to the stage where they have erectile dysfunction. So keeping on top of your health, your blood pressure, your blood sugar, not eating too many sweets will actually help as well, which I know sounds counterintuitive, but that's actually the case.
Okay, now talking about sweets, I know that alcohol, beer, as the case may be, how does it affect? Does it affect? Because I know that talk around is that it can really affect. People talk about sugar and about sweet stuff, but probably there's some bitter stuff that have even more sugar than the sweet stuff. Is that so?
Yes, I mean that is so. Is the composition of what you're eating actually? So if you're eating, bitter foods, but they have a lot of fat, a lot of cholesterol in them, that can actually cause erectile dysfunction as well. Sugar is a very obvious cause. Sugar causes erectile dysfunction because it gives you a high chance of diabetes. Okay, so if you're having lots of sugar, you might have diabetes in the future, and that's one of the biggest causes of erectile dysfunction in the future for men. So it's something that actually is it's a two-edged sword. So where bitter things, if it has fat and has cholesterol in it, can cause erectile dysfunction, and if it has sugar as well, can cause it. So it's about moderation. So you could just doing things in moderation would be the best way to manage it,
Okay.
prevent yourself from getting it.
All right, so let's talk about curative measures and all of that. After the case has been, established and all of that, how can men go about curing it? Like you said, a number of men don't like talking about it. It's, how can men go about curing it?
I mean, first of all, before thinking about curing it, I think the first thing to consider is actually making sure people are aware that actually it's not a stigmatized condition and that it's very, very common. So if you have erectile dysfunction, don't be afraid to seek help from your doctor or from your GP. That's the most important thing. Then once you seek help, actually, then we can look at curing it. The first thing people use is actually the first medical treatment people use is actually Viagra. And that actually helps you to be able to perform as such. But before getting to that stage, what should actually happen is that you should get a workup from your doctor to actually realize what's your actual cause. So your blood pressure should be checked, your blood sugar should be checked, and those things need to be treated. If those things are treated, then you're very likely to be treated to be permanently cured of having erectile dysfunction in the future once you've been treated of those conditions. But if that doesn't work, then medication can help. Viagra can work, and also there's something called a vacuum pump as well, which some men use, and it helps them as well.
Okay, so you are advocating it's more about treatment and managing it, or something. There's not no, you cannot generally say something is curative and all of that about it, right?
Yeah, so you have to cure the underlying symptoms. So if it's you have to find the cause of it in yourself. So if it's high blood pressure, you have to treat that. If it's cholesterol, you have to treat that. If it's heart condition, you have to treat that. So once you treat that, then you have a good chance of cure. But the point is that you will still be able to perform as such, and have a healthy sex life, even if you have erectile dysfunction, as long as you see someone about it and they can actually manage the condition for you.
All right, thank you very much, Doctor. It was quite enlightening talking to you about this, and looking forward to our continuing our further discussions this month on health with you. Thank you. Have a wonderful day.
Thank you. You too.
All right, that's it on health. We'll take a break now. Don't go nowhere. There's still more to come on the show.